Hello, I am Dr. Manoj Kolhe. I am a medical gastroenterologist, hepatologist, and therapeutic endoscopist at Manipal Hospital, Baner, Pune. Okay, we will discuss about the rise in a colitis, IBDs, and Crohn's diseases in a younger population of India. So there are multiple factors associated with. First thing is a rapid urbanization and a change in diet. Traditional Indian diet was more or millets and green vegetables, fruits, and salads. But over the period of the last 50 years, we have our diet has been westernized and we are taking very high amount of fat and ultra processed foods, and there are multiple additives and there are multiple insecticides in a food. So these are the multiple things act as a hapten to generate the immune mediated reaction in the intestine. So all IBDs are actually immune mediated diseases and they create inflammation in your intestine. It can be a large intestine or it can be a small intestine, which creates the symptoms and which causes the multiple morbidities, and sometimes patient may also lose a life. Second cause of a rise in IBDs in the younger population is gut inflammation. Generally, it is secondary to the gut microbiome. In the last 100 years, if you see, the multiple researchers have found out that variability in the gut microbiome has been changed over the period of times. Gut microbiome actually are billions of bacteria residing in our intestine, and they has a relationship with our body. So if this bacterial variability changes and the amount of or number of bacteria decreases, or there is a change in pattern of the bacteria, they can create some obnoxious elements in the intestine, and that can cause the gut inflammation, which causes the IBDs in the younger populations. People nowadays are not eating more natural or raw food, or they are more eating a westernized or the more fatty added food that creates the change in gut microbiome, and which causes the leaky gut, which increases the chances of inflammation in the younger population. Over the period of time, there is a rise in C-section, LSCS section in the kids, which has actually changed the gut microbiome. Natural birth gives the chance to the baby to get gut microbiome or from the mother's vagina, but because of the C-section, there is a lack of this mechanism, which can increases the chances of changes in gut microbiome, which creates the problems. And during the LSCS, there is multiple antibiotics given, which may be transferred to the baby, and which changes the flora of the baby's intestine for permanently, and which can create problems. So IBDs also has a genetic susceptibility. There is a one angle which shows that people who has IBDs, their kids or their next generation has a higher risk of getting IBDs. Because of the multiple drugs and medications, people are surviving because of the IBDs, and their next progeny also getting the this IBD or colitis. So genetic susceptibility is one of the problem. And next thing is rapid urbanization and increase in the pollution, which actually increases the contamination of food. Multiple pollutants, insecticides which are mixed with our food and which go into your intestine, which are indigestible, and they create inflammation. So rapid urbanization has affected our population, which they're making them more prone for the IBD. One of the reason is actually the gastroenterologists are doing more colonoscopy and more diagnostic test, and which has diagnosed multiple undiagnosed cases are because of the new advances, technical advances in the medical field, new instrumentation, new test has multiple advantage to the doctor, and which has created a more chunk of IBDs in the younger population, because nowadays, because of availability of multiple tests such as stool fecal calprotectin, capsule endoscopy, high imaging colonoscopies and endoscopies has increased the yield of the diagnostic test, and they are diagnosing more Crohn's colitis or ulcerative colitis in the kids. So all these factors actually affects the gut of the younger people. Younger people are having a more genetic susceptibility, and outside environmental factor create a complex immune mediated reaction in the kids intestine. That's why, that's why younger people, or more and more young kids which are less than 10 years are getting diagnosed with a Crohn's, colitis and IBDs. And multiple drugs also has a immune mediated reaction in the intestine. They are creating more IBDs and more complex conditions in the IBDs. So the thing is ki we have to go back to the basis, and we have to relive the life like a rural people live the organic life, and away from all the pollution and contamination. That's the key for avoiding the colitis or IBDs in the younger population. Thank you.